When it comes to healing your body, there are many options. What are you going to do? Who are you going to see, right? Do you call the Ghostbusters? I don't know, right? But I do know, actually. So that's why I'm going to share with you what to do. So you've got choices. It can get overwhelming. The voices are many, and there's lots of noise, what I call noise in social media about healthcare. So wherever there's anything that creates fear of missing out, fear if you don't do this, you'll die, fear if you don't do it this way perfectly, you're not going to recover, steer clear. I'm just going to give you that as a public service announcement. But then the other thing is, what's the difference between integrative medicine physician, a holistic physician, and what instances do you use them? Where's traditional medicine fit in? Well, traditional medicine is great because there is a standard. There's a standard of care. There is a way to do things, and there's a way to find answers. The challenge with our standard of care model in our country, honestly, is how it's executed, not the intention, nor the intention of the physicians, because by and large, physicians are healers, and they want to help people. That's why I entered the profession. But more, I have a passion about figuring out why and a curiosity of what's going on. And that's really what spurs me to find out answers for and with my patients. So the standard of care model works great. It works if things are straightforward. You're going to go this way. You really believe in medication, and you really believe, that finding the answers, and especially if you need a surgery, you want to do and go to someone who's the best at what they do. So we have great care that way. Where it's challenged, I think, in our standard of care and our standard model is the chronic conditions, the things that aren't clear, the things that we can't just hang a diagnosis and find a treatment that's really linear. And that's mostly chronic things, because chronic things always have multiple factors to them, multiple causes, multiple correlations, multiple reasons. So it's unfair to say to the patient after seeing them the third time when your treatment doesn't work, well, I guess this is in your head. You see ya. Here's a tablet. See you later. Nice to know you. That's unfair. I think it's short-sighted. And that also describes the majority of patients that I care for. They come to me after they've had that experience. And so I know where not to look, because I know where you've already been looking. So that's helpful. But going back and teasing out the history, listening to your story is super important. Giving a proper exam is very important. And then having a myriad of choices for testing. And then you've got the functional medicine testing, which looks at stool studies, which looks at hair analysis, which looks at organic acid testing. That looks at underlying biochemical processes that support what we later know as clinical medicine. So it has its roots, medicine has its roots in science. And a good physician is able to take that basic science and apply it clinically to the patient. There isn't any black and white in this, and there isn't any absolutes. I wish there was, because that would make my job so much easier, but there isn't. And so what you've got to do is work closely with your provider, work closely with your physician, work closely with your practitioner. Let them understand what your needs are, what your goals are. Arrive at treatment plans together. Use all the options you have. Use as many tools as you can, knowing that you're looking to find out the root causes, upstream causes, and multiple ways to treat this that are beneficial for you. Hopefully that's been helpful, and thank you for sharing your time with me today.